Impact of Design and Planning on Health. This is an overview presentation by Andrea Marquez.
Let's begin by asking you to define health. Take a moment to think about what this means to you.
It is a state of complete physical and mental and social well-being, not merely the absence of disease or infirmity. And what about the definition for design? This definition doesn't have to be concrete, it can constantly change, and it is specific depending on what is the problem at hand.
The social determinants of health is how the layers of our surroundings and our environment affect our daily lives. Health outcomes may be impacted by factors out of our control. Gardens or outdoor spaces may be limited by our natural environment or building code standards in the city. The decision to be physically active indoors may be limited by the city's funding to construct YMCAs and conduct free health screenings. Our built environment creates daily stressors, which influences our choices and behaviors, thus impacting our health and well-being. We're going to be talking about cardiovascular health, respiratory health, and mental health. And this will specifically relate to Detroit and COVID-19. Let's jump right in. Are you sitting down right now? How many hours a day are you physically inactive?
4 out of 5 adults do not achieve the recommended physical activity guidelines, and this is according to the American Heart Association. Physical inactivity impacts heart health, which may lead to cardiovascular disease, and this is the leading cause of death in the United States. Nearly half of Americans have some sort of cardiovascular disease. As you can see, there will be projected costs that reaches $1.1 trillion by 2035. In Michigan alone, the obesity rates are at a high level in comparison to other states. Detroit Youth Risk Behavior Survey found that 19% of high school students were obese. We're going to be diving into the respiratory health portion with the yellow marker onto the right. So the environmental injustice does lead to public health disparities, impacting respiratory health, which may lead to other health problems. And this can be improved with health surveillance and enforcement, including regulatory chemical monitoring for certain industries, especially in Detroit. And there is a prevalence of asthma in Detroit. As you can see, the darker green shows the zip codes for which there is prevalence of 6.71% to about 8%.
The graph on the right shows a cumulative risk in Detroit Tri-County area. Factors are overlaid, such as age, income, and race, which can increase vulnerability to air pollution. So as you can see, Detroit has the highest impact index. Locations with high proportions of people of color are more likely to experience higher exposure to air pollutants and associated health risks.
So this is a critical question during COVID. How can we promote outdoor activity if the air quality increases respiratory health risks? So even if you do stay indoors, there is a risk for COVID-19, and if you go outdoors, there are other risks. So there are a couple of risk assessments that can be conducted. There is also a human health risk assessment that can be conducted to determine who is the population at risk and what is the environmental hazard of concern. Recently in Delray, there was a community benefits agreement for the residences in exchange for the highway system that's going to be implemented through Canada and Detroit and Delray. There's going to be a swap house agreement, and even though the residents did want a health risk assessment, I think they were able to get an environmental health risk assessment conducted instead. In relation to COVID-19, these are the worry and stress levels that will impact mental health. So in early March, you can see there was a 32% reported, and in late April, it jumped to 56%. In response to these worry and stress levels, there are strategies that could help reduce them. For example, gardening have an impact on cortisol levels. So as you can see, 15-minute intervals, the cortisol levels does decrease based on the stressful event. This is a diagram by Nick Hennessy, a local colleague whose project was in response to COVID-19 in interior spaces. So balconies were used as a secondary space to be social. Online activities, classrooms were conducted differently. So approximately 25% of patients with heart failure had a moderate or high level of perceived social isolation. So as you recall from earlier, cardiovascular disease is one of the leading causes of deaths. So about 25% of them have a perceived social isolation. So with increased aging, more and more people will be living alone. And if people have to be socially isolated, how does that affect their health? So how can we support mental health without exacerbating the loneliness crisis among older adults?